So now we are done with taking history and doing clinical examination of the patient. So next step is to request some investigations. So being a safe physician, it is important to make sure that there is no structural intracranial lesion. So for this, we do CT scan or MRI. CT scan is less expensive and easily available, but it is considered as a less sensitive modality. So we perform MRI. On one hand, these neuroimaging studies rule out mass intracranial lesion, while on the other hand, they show us signs of raised intracranial pressure. So you can say that performing MRI is the first step. We also perform MRV or magnetic resonance venography. As I told you earlier that venous sinus thrombosis is one of the cause of pseudotumor cerebri. So this can be useful in patients in whom some procoagulant state is suspected or who are at risk of dural venous sinus thrombosis. Next step is to perform lumbar puncture. Once intracranial structural lesion has been ruled out with the help of MRI, we can safely perform lumbar puncture. We keep the patient relaxed in decubitus position and measure the opening pressure of CSF. We also look for its color and clarity, and we send it for cell count, cytology, culture, glucose, protein, and electrolytes. But actually, in case of pseudotumor cerebri, there is nothing wrong with CSF except for increased opening pressure. Blood tests have very limited role in diagnosis, but sometimes they do help us, like autoantibodies in case of SLE, hormonal assays in case of suspected endocrine diseases, and procoagulant profile when venous sinus thrombosis is suspected.